When we're thinking about supporting overall microbiome health, not just during like acute or chronic diseases, we really want to start thinking about really complex blends of fiber. Not that veterinarians need to get into the weeds of how microbes utilize fiber, but more of the idea that these products that include fiber blends become really important for helping to support that diverse microbiome.
Hello, VetFolio Voice family. Thank you so much for joining me. This episode is sponsored by Hills, and in this episode, I'm joined by Dr. Janessa Winston to discuss the role of the microbiome in so many aspects of illness and health in our patients. Now, for me, I absolutely love talking about this, and you'll hear me kind of allude to that, not allude to it. It's very direct that I'm excited to talk about this. But I get so excited when I think of all the doors that this could open into new understandings of disease processes and therapies. And really, it seems like we're just scratching the surface here. So in this talk, Dr. Winston and I got into the influence of the microbiome throughout a pet's life. We talk about critical development windows in puppies and kittens and how damage to the microbiome from insults like parvovirus or poor nutrition or antimicrobial exposure can have potential impacts beyond the immediate insult and throughout the animal's life. And of course, we talked about how to support the microbiome, including nutritional considerations and the latest on FMT or fecal microbiota transplantation. If you're as excited as I am about learning more about the microbiome and what the research is saying so far, this episode is a must listen. This was such a great conversation. Let me tell you a little bit more about Dr. Winston, and I will no longer hold you in suspense. Dr. Janessa Winston is an assistant professor at The Ohio State University. She earned her veterinary degree from North Carolina State University in 2011, followed by a rotating small animal internship and residency in internal medicine at NC State. Dr. Winston became a diplomate of the American College of Veterinary Internal Medicine in 2015, and she also completed a PhD in comparative biomedical sciences with a focus on microbe-host interactions at NC State in 2019. Dr. Winston's research focuses on microbe-host interactions during health and disease, with particular interest in microbially derived bile acids. She's the chair of the International Companion Animal FMT Consortium and has launched the Companion Animal Fecal Bank at OSU to further study and translate microbiome research into clinical practice. Dr. Winston is currently leading FMT clinical trials for feline obesity and canine parvoviral enteritis, which we talk about a little bit in this episode. She's also the recipient of an NIH NIAID K08 award studying the gut microbiota's role in C. difficile infection during inflammatory bowel disease. Wow, that is a very humbling bio, and her knowledge and her passion and her excitement for this topic really come through in our talk here. Let's go ahead and get into it.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on vetfolio.com.
Well, I'm super excited for this episode to be joined once again by Dr. Janessa Winston, and we're going to talk about the canine microbiome, or I guess just the microbiome in general, but I think probably a lot of focus on canine up to this point, which is awesome because this is such an emerging area of data, of research and therapeutics and all of those things. So Dr. Winston, thank you for joining me.
Yeah, thanks so much for having me back. I'm really excited to get to join you again.
Yes, absolutely. And this is such a cool topic. So let's jump right in. One of the things we're kind of covering here is microbiome as it relates to the development of animals throughout their lifetime. And so one of the terms I've heard is are these microbiome like developmental windows. So can you talk a little bit more about that? What are those and what are maybe specific times we should be aware of that might be more important and influential in dogs and cats over their lifetime?
That's a great question. And I think that, like you said, we are rapidly learning about the microbiome and health and disease. And your question really hits on the health side. And we know a lot more on the human side and from rodent studies, but there's building evidence that is starting to look at the development of the microbiome in dogs and cats, although there's more literature right now in dogs, to really look at what that maturation steps look like. So I think probably not surprised to any of us veterinarians is that the biggest shifts that we're going to see are going to be in the weaning period. So as animals are transitioning from milk from their moms, that there's going to be a big transition in what microbes are going to be present as they switch to solid foods. So at weaning, we're going to see big changes in the microbiome, just of what community members are there, because a lot of what drives the composition of our microbiomes is the diets that we eat. And so as then we head into later stages, a lot of people are kind of putting the time frame for microbiome development really being 9 to 12 weeks. So this is when animals are starting to get more of the species in their microbiome that we're going to see through adulthood. And actually, if you look at the human literature and you look at kind of like when infant microbiomes start to mature, that 9 to 12 weeks in dogs kind of equates to roughly 2 to 6 years in children. And so that maturation kind of parallels each other if we're looking at the differences between dogs and people. And these windows are important because any alterations that could happen, like let's say an animal, gets an infection and needs to go on an antimicrobial, any changes that we make to the microbiome at those times could have impacts later in life. In vet med, we don't know all those implications, but it is something that we're starting to really kind of look at and think about these critical windows for when that microbiome community is starting to set up and how disruptions during that early life could have impacts long term for our pets.
Gosh, it's so interesting. You're right. Like logically, it makes sense to think of that developmental window occurring at weaning. And I think logically, at least in my brain, it makes sense to think that impacts to the microbiome at that time can have long-term effects. So I just think it's such a fascinating area of research to help uncover how that works and what those effects might be. Certainly, one of the major GI impacts we can see, especially when we're talking about dogs and young puppies, is parvo, that virus that, we all hate to see. And, we're seeing major disruptions there. We know what it does to the villi and the intestines and all of this. So, do we have any information about how that might affect the microbiome and what we might see down the road?
Yeah, this is an area of interest in our lab for sure. So when we think about parvovirus, the tricky thing about that infection is it usually happens in unvaccinated or undervaccinated dogs, and it happens to usually align with the time frame that we're talking about this microbiome maturation and development. And so if your patient takes a viral hit of getting parvo, and as you alluded to, we know how that virus is going to attack rapidly dividing cells, particularly in the GI tract, those animals are going to be at risk for having disruptions in this maturation. And I think one thing that's important is that all dogs that have parvo, they need to go on antimicrobials. That virus is causing damage to their GI tract, which can lead to translocation. And we're talking about a population of dogs who are immunocompromised because that virus is also going to attack those white blood cells that are rapidly dividing too. And so all the parvo dogs, not only are they having this hit of this destruction of that ecosystem at the level of the gut, but then we're also needing to cover them for sepsis with broad spectrum antimicrobials. All dogs with parvo need antibiotics. And now we're throwing these antimicrobials at these dogs that are further disrupting what microbes they may have remaining. And so Parvo is kind of the perfect storm of a massive disruption in the gut. And a lot of dogs, this, equates to that maturation period for the microbiome. It also, in a lot of those pets, corresponds with when we're going to see maturation of the nervous system and the neurodevelopmental window, which in dogs is thought to be up to 3 months of age. And so if we think about all the ways in which the microbiome is important, and one of those is development of our nervous system in general, so that gut-brain axis that maybe you've heard about, we're now having a hit to the central nervous system and to that neurodevelopmental window that could also have implications later on. And we know from retrospective literature and dogs with parvo that a high percentage of them go on to develop and are at risk for developing chronic enteropathy later. What we don't know is what things can we do in the short term to try and reestablish that gut ecosystem to try and prevent that from happening. And that's an area where we definitely need more research to figure out how could we prevent or at least increase the likelihood of recovery of that microbiome and get those puppies back on a good trajectory for microbiome maturation that mitigates their risk for developing chronic enteropathy long term, or also potentially mitigates their risk for these neurodevelopmental components that we don't even think about in that population of pets.
Feel like this explains so much about my Rottweiler I had through vet school. I love him so much, but I got him when someone abandoned him with parvo, and yeah, he was we'll just call him a behavioral mess. And who knows if that had anything to do with his parvo or the fact that he was a Rottweiler, and they're their own special,
Or
uh,
both.
or both, or both. They were working hand in hand. But
Yeah.
that's what I think is so fascinating and exciting and kind of unnerving at the same time, to think that it can also have impacts not only on long-term gut health, but also, behaviorally and neurodevelopmentally. Is there any data to suggest the microbiome is affecting systems outside of the GI tract and the gut-brain axis? I'm thinking of things like porous 1, where we're targeting the GI tract to affect kidney disease, but even still, we're really working within the GI tract for that one.
Yeah, that's a great question. Absolutely. Like you can put any organ system and combine it with the gut, right? So I think that we are learning more and more about how this microbial ecosystem that lives within our gut, and actually even some of those microbes that live within the organ systems we're talking about. So like even thinking about the skin microbiome. And there's some people that think that different areas, even that we used to consider were protected, like urinary microbiome. In fact, on the human side, I recently saw a brain microbiome
Oh my
is
gosh.
starting to come out there. We can put microbes kind of at a central role in a lot of our physiologic processes. And I think that's important because I don't know about you, but during vet school, like I didn't learn anything about the microbiome. So
No.
this idea of having to, as a clinician, start to think about the microbiome as its own organ system is becoming really important. And I'm glad that you brought up porous 1 because feline chronic kidney disease is one of the things that our lab is also interested in collaboration with Dr. Stacy Summers at Oregon State, but also Jessica Quimby here at Ohio State with me. And we've recently published a paper actually starting to further push the idea of this gut kidney axis and potentially even how some of the metabolites that microbes make, such as bile acids, may actually be resulting in changes that are happening at the level of the kidney that could cause progression of that disease. And so we're starting to think about the gut microbes, and porous 1 is one of those factors of trying to, bind up uremic toxins that also can lead to progression of that disease. That's another aspect of like, I never learned anything about the gut microbes when I learned about kidney disease for pets. And here now we're having to start to think about that. And I think it's really exciting because it also opens up a huge window for potential therapeutics that we really haven't considered before for some of these diseases.
Yeah, and you and I share that excitement. The first time I learned about being able to target the GI tract to affect chronic kidney disease and the possibility that opened up to potentially affect other organ systems. I mean, that's huge to say a whole new therapeutic target here. as opposed to like, there's our hands kind of being tied of there not being much we can do. Turns out actually there may be a huge opportunity there to influence the health of these cats. So yes, I absolutely share that excitement for that area of research. And then, certainly brain microbiomes. I mean, like skin microbiome, goodness gracious, we treat so many allergies and things. It seems like there's just a huge window of opportunity there to change the way we've approached therapeutics up to this point, which is super exciting.
Yeah, well, and bringing up atopy in general, like there was a great publication that came out just, a year and a half ago or so that looked at actually using microbial directed therapeutics such as fecal transplant to try and reduce the amount of additional medications that dogs with atopy required. So
Wow.
trying to get them off of their steroids and topical applications by modulating their microbiome in their gut, which is just absolutely wild. And I think is another great example of really highlighting this gut organ axis. And I think Rob Knight, who's one of the leading researchers in microbiome science globally, he always says that the gut is not Vegas. And so things that happen in the gut don't stay in the gut. And I think that's something that I've always carried with me through my training of really thinking about how these microbes that we used to think about them just impacting GI health are actually impacting physiology and health and disease across all organ systems in our pets.
The gut is not Vegas. I love that. I will remember. I mean, I think of that anyway, but that's such a good way to just keep it in your brain of whatever you do in that gut, it's going to affect the rest of the
Yeah,
body.
again, every time I hear him say that, I think it really hones in the point that this is an area that during my veterinary training, I didn't know how to make it a pause point for thinking about therapeutics and overall health. And I think now, we have building evidence that we need to start thinking about it as its own organ system.
Yeah, and it just the idea of us starting to think about it and the evidence and the information that's emerged so far. And we're talking about the skin microbiome, and whenever there's some possibility to help with atopic dermatitis, I always say like I have the perfect patient. I'm like this one, what can we do with him? Because he's just a really really challenging case that I've managed. And so I feel like it kind of shifts that mindset of like, oh, well, we have these options, and if they fail, then we just do the best that we can with what we have and see how it goes. In the future, we may start to approach this in a whole different way and have different types of success, which I think is encouraging and kind of keeps it very very intriguing and saying, okay, maybe we can continue to improve and do better in ways we never even thought of.
Absolutely. And I think the importance when we're thinking about that, and especially in terms of the microbiome and its maturation, is really starting to try and transition and thinking about the microbiome and the health span of our pets and how, how are we going to promote the normal maturation, but also maintaining that healthy ecosystem for as long as we can, because as we learn about how the microbiome impacts so many different disease states, we also have to be really thinking in a preventative mindset of how can we prevent changes, detrimental changes from happening to that ecosystem, but also how do we, if changes do happen to it, because inevitably, animals have hits to their microbiomes. They, are at the dog park and get in a little scuffle with another pet and need to go on an antimicrobial. Like this is real life. These things happen to our patients. And the more that we start to learn about how we can try and get them back into that state of health is going to become really important.
Sure. And I want to talk more about that of how we get them back to a state of health. But before we do that, can we stay on the imbalance of the microbiome for a little bit longer? Because we've talked about parvo and antimicrobials and the impacts that those can have on the microbiome. What else should we be considering outside of, say GI disease or antimicrobial therapy that can affect the gut health and the healthy microbiome that we want to see within the gut?
Yeah, probably the simplest way to think about it is kind of two components. The intrinsic part, which is the individual pet piece, that like this is where genetics and the immune system and all that kind of comes into play. But the other part is the extrinsic part. And this is the part that we have influence on. This is, what environments our pets are exposed to, what water sources they're drinking, what diets we're feeding them. A lot of pet food companies are spending a lot of time and money investing in microbiome science to try and really push forward the evidence behind how diets are formulated to try and help keep that microbiome as healthy as it can be. And so I think all of us, at least for me as a veterinarian, like when I prescribe certain diets or even recommend certain diets, I'm really thinking about the pet and a lot of these companies are really forward thinking of putting in the science to really think about how the diets, yes, are ultimately, providing nutrients to the pet, but also how these diets are providing nutrients to those microbes to try and support that healthy microbiome. So I think and nutrition is one of the major areas that we need to think about and how it impacts those microbes.
Do we know kind of, well, I'm assuming we have some information if these diets are being formulated this way, but what kind of information is out there as far as different ways to use nutrition to support the microbiome? Like, are we talking about fiber, or fiber is the one that comes to mind? You know much more about this than I do. Are
Yeah.
there certain things to look for?
Absolutely. So I think fiber is the big ticket item, and not all fiber is created equal, right? And different microbes use fiber in different ways. And so we've talked a little bit before about fiber and psyllium, and that type of fiber is very specific. And I definitely recommend using that for acute colitis and chronic enteropathy cases. But when we're thinking about supporting like overall microbiome health, not just during like acute or chronic diseases, we really want to start thinking about really complex blends of fiber. And a lot of the companies now are including different components of soluble, insoluble fibers that really cater to the variety of requirements of those microbes. And again, like this is where not that veterinarians need to get into the weeds of how microbes utilize fiber, but more of the idea that these products that include fiber blends or even diets that include a variety of food sources that have multiple different types of fiber become really important for helping to support that diverse microbiome. And there's a lot of evidence on the human side that diversity does matter, and especially if a microbiome takes a hit like an antimicrobial, having a diverse community that then can try to come back after that hit becomes important for reestablishing that population.
Interesting. Gosh, it's like so many things in nutrition in general of, like you said, it's not a one size fits all. It's not we'll add psyllium and we're good to go, but looking for that healthy combination and then learning more and more about how that influences the way the gut is using fiber.
Yeah, absolutely. And I think that's where, really taking the time during your quick 15-minute appointments and making sure that the nutritional aspect is recorded for your patients becomes really important, especially for when we're talking about health span for our pets.
Sure, sure. That makes a lot of sense. And thank you for letting me go backwards there and talk about how we're supporting a healthy microbiome. Let's go back to if we get a disruption in the microbiome from all of these things that can happen. What are some of the therapies? How can we approach that if we have a dog that has a known disruption in the microbiome?
Another great question. So this area is just absolutely exploding in veterinary medicine. And I don't know about you, but even though this is my area that I look at, it's hard to keep up with all the literature because so many new things are coming out, which is really, really great. I know we don't have a ton of time to talk today. We could spend hours going through
Yeah,
all the different
unfortunately.
probiotics that are available on the market, the single strain versus multi-strain, and when to use those and when not. I think probably that one of the newer things, and not that it's new in concept because people have been using it for thousands of years, is the idea of fecal transplant. And this is the idea of where you're taking feces or fecal material from a healthy individual and you're transplanting it into a diseased recipient. So, like a dog who had parvovirus and is on antimicrobials to prevent sepsis, or a dog who has chronic enteropathy and has had chronic GI signs that aren't managed with traditional therapies, or even those that are newly diagnosed. We know that that disease has disruptions in the microbiome too. Fecal transplant is one of these therapies that is becoming more mainstay when we think about at least our initial approaches to various diseases. And recently, an international group known as the Companion Animal Fecal Transplant Consortium just put out guidelines for practicing veterinarians to figure out how do you go about a fecal transplant? What does it even mean? What evidence is there? And it's a hefty document, but it's a document really meant to help clinicians of all practice types. So not just ivory tower at the universities, but all practice types really learn about what fecal transplant is and figure out how would you go about picking donors and how do you process the feces and what are the clinical indications. And right now, based on the literature that we have, the consortium felt like there were, just a handful of diseases that we have enough evidence for fecal transplant. That's dogs with parvo, dogs with chronic enteropathy, and cats with chronic enteropathy, and acute colitis in dogs as well. And those ailments, essentially, we have a lot of other treatments that work in those as well, but it's adding on fecal transplant to really address the health of the microbiome in those diseases as kind of like a multimodal approach. And so if people haven't seen those guidelines, I highly recommend it. It's meant to help increase the accessibility of FMT in all practice types.
Sure, sure. And I want to talk more about the process of FMT and making sure, that that's accessible because I know you and I have talked about that a little bit. And this does not sound like, anything that would be outside of our wheelhouse to do in general practice to help our patients. But thinking along the lines of what you said there of the diseases you listed, chronic enteropathy, acute colitis, and parvovirus, especially thinking long term with chronic enteropathy, like you said, not as a replacement to say, oh, we're not going to use our other therapeutics, but our other therapeutics come with their own limitations as well. So to really use it as part of that multimodal plan and maybe be able to back off of some of the other therapeutics a little bit, and or if we have, a patient that's not tolerating a drug or something like that, just, like we've been talking about this whole time, give us so many more options for these patients.
Absolutely. And I think one thing that we don't talk a ton about in the chronic enteropathy realm is flare-ups. Like, we never cure animals who have chronic enteropathy. The goal is to try and manage their clinical signs and reduce inflammation in order to try and control diarrhea and any other, whether it's nausea that some of them have and vomiting, whether it's weight loss. But in the end, like, we are not ever fully curing these pets. And so animals inevitably with chronic enteropathy have flare-ups. And although we tend to thought about, at least from my perspective as a gastroenterologist, internal medicine specialist, like I used to think about FMT as kind of like last resort. I've done everything. I've maxed out on every therapeutic that I have for this patient and they're not responding. Maybe I should try fecal transplant. And now I'm really shifting my clinical practice where now thinking about the microbiome health and chronic enteropathy comes much sooner in my multimodal approach. And I think members of the consortium, FMT consortium, feel the same way. And so I think that's a huge paradigm shift for what we used to think about when to reach for FMT, specifically for those chronic enteropathy cases.
And it sort of makes sense too, because correct me if I'm wrong, obviously this is your area of expertise, not mine, but with chronic enteropathy, from what I understand, dietary therapy and nutrition seems to be the major therapeutic for treating chronic enteropathy. And that's where we're seeing the most response and the best chance for long-term remission or control of clinical signs. So it makes sense with what we were talking about earlier, and nutrition playing a major role in supporting a healthy microbiome, that reaching for FMT sooner as another way of supporting and maintaining this healthy microbiome would be effective and absolutely something you would want to implement early on in the diagnosis.
You are absolutely right. And from my perspective, the majority of cases that have chronic enteropathy never end up in a specialty hospital. They're ones that veterinarians are able to manage with diet, right? And they may occasionally have flare-ups and whatnot. And this is where fecal transplant can start to be incorporated for those pets much sooner than we used to think about it. But absolutely diet and nutrition and trying to support that healthy ecosystem from the host side, but also from the microbe side really makes a big difference for these patients.
Absolutely. Well, I've been convinced as far as the utilization of FMT and the benefits that it can provide. But thinking about it at face value, when you say fecal microbiota transplant, it can conjure up some images of maybe things that aren't the most glamorous things we want to be doing in practice on a day-to-day basis. So, can you talk a little bit about the process and how that works? What kind of options we have in terms of commercially available products versus screening donors or any other options that might be out there?
Yeah, again, those guidelines go through this, but just to give like a an overview. So, if you're interested in starting fecal transplant in your practice, you kind of have to start by asking yourself one big question of, do I have the time and resources to maintain my own fecal bank? And what that means is having a set of healthy individuals that you have screened. And again, there's like a step-by-step guide in the consortium guidelines to give you like what you should screen and how you should identify those good donor dogs. And do you want to maintain that population and then also maintain making the product? So the gold standard for performing a fecal transplant is really fresh is best. And so in an ideal situation, you would have a screen donor that then you would freshly collect poop on in the morning. You would then take that fecal donation and you would mix it, usually with saline, and have it ready to go as an enema for the pet. That mixing and making the product takes some time and effort and coordination. And as a veterinarian, I know I don't always have time to maintain donors that I can rely on to bring in samples and to make the product fresh. And so that means in our lab, we actually have a donor pool that then we are making products that we can store. And there's all sorts of new research coming out, including from my group, about how you do that and what that looks like, and whether you're going to use a frozen product or whether you're going to use a lyophilized product, which means that you've taken feces and you've freeze dried it to utilize. And that can be super overwhelming for many practitioners to think about just the logistics in your practice of how you're going to do all these steps. And so at least in the United States, we're really fortunate to have a commercially available source of lyophilized canine and feline feces. Animal Biome is the fecal bank. It is a product that can be purchased, at least the capsule form, by owners, but they also have a veterinary specific website where veterinarians can actually purchase vats of lyophilized feces that you can reconstitute in your practice for individual pets. And the benefit of lyophilized products in general is just the shelf life. So you guys are busy, and if you have a pet that's coming in, or even you have the parvo puppy that you're treating, in isolation in your practice, having to coordinate a donor coming in, defecating, you mixing up the poop, and then you giving it as an enema takes a lot of manpower and time, whereas having a product that's on the shelf may be more practical for your practice. And that's where relying on a commercially available product may be useful for veterinarians. And so again, I have GPs that I talk to that they are really dedicated to wanting to have their own donors, because we do know that when we freeze dry products, whether it's in my lab or in a commercial fecal bank, we do reduce the viability of microbes. And so far in the literature, that hasn't changed efficacy, especially for chronic enteropathy. Our lab is testing that for parvovirus right now, and we've been seeing in interim analysis good results with the lyophilized product. But for each disease that we talk about, that's going to be a question that comes up, at least on the veterinary microbiome science side, is lyophilized okay alternative, or do we need to go back to fresh is best? And so those are active areas of research in many areas and diseases across veterinary medicine to help provide practitioners to not just think about FMT, but also think about, well, what's the best formulation, what's the best route of administration, et cetera.
Absolutely. And I think you're just speaking to how much emerging data we're going to see when it comes to enteropathies and FMT and all of this and different storage methods and availability. But certainly, if you aren't in a place where you want to maintain donors, I think it's really encouraging to hear that you can have a commercial product that you can mix up and administer in a busy practice setting where maybe it doesn't make sense to maintain fresh samples. And then I'm sure other modalities will come out down the road and we'll find even more and more utility for this. I'm curious, thus far, you mentioned seeing good results so far with testing this in parvo. What kind of data do we see as far as whether it's reducing therapeutics or remission rates or things like that with FMT in different disease states?
So, in the parvo realm, we only have a single paper right now in the peer-reviewed literature, and it's basically looking at giving parvo dogs an enema of a fecal slurry every 48 hours until their diarrhea resolves, which means that that patient population would need to be hospitalized for that full time. And I don't know about you, but like I have a lot of owners in our population that maybe can't even afford to hospitalize their pets
Right.
for that extended period of time. And I know some veterinarians who are grossed out by having to give a fecal transplant via enema and don't want to work with the feces in general. Can you imagine asking an owner to do that? Like, that's not a treatment that we can send home with owners to give as an enema.
Sure.
And so our lab has started to look at a different protocol where we're giving an enema kind of at initial presentation. So this would essentially be like pet who's coming in with parvo, but they're electing for outpatient therapy. You could give an enema right at your practice. And then what we're testing is sending them home with oral lyophilized capsules for the 2 weeks following to see if we can get similar results to what was seen in the paper of giving them an enema every 48 hours. And really the goal of this change in formulation and dosing is just to see if we can increase the accessibility by making it so it's not just a treatment for parvo dogs that needs to be happen at your practice in order to increase that spectrum of care.
That is very cool. Because I hear what you're saying in terms of increasing accessibility. I'm also thinking of these poor parvo puppies and how serious this can get. And it seems like there are ways that it could be managed. Bring the pet in every 48 hours, and we're doing these enemas. But yeah, it could get a little intensive, especially when we're talking about isolation protocols and things like that. So, any data so far on oral capsule administration, or is that still way too preliminary to comment
Yeah,
on?
so at least in our hands for parvo, we're seeing very similar results. And actually, we had a placebo-controlled arm of that study where we have parvo dogs that are not receiving FMT. And actually, in our interim analysis, we found that the only dogs that were removed by the clinical team from our clinical trial were ones that fell into that group that got placebo, so they didn't get FMT. And in the end, after looking at interim analysis, we did not feel like it was ethical to continue to treat parvo dogs without FMT based on our results. And so now for the remainder of the clinical trial, we've removed that group. So every dog in our clinical trial is getting FMT. The difference that we're now looking at is actually has to do with the donor, which we haven't really talked a ton about donors. There's very limited information on the veterinary side about how you screen kind of for the ideal donor. But one thing we're looking at in parvo is whether donors that are fed conventionally, so with standard commercial diets, compared to donors that are fed with raw fed diets. And I know a lot of you are probably cringing on the phone call, like, how could she talk about raw fed donors? But there is a group of veterinarians that feel very strongly that the microbiomes of dogs that are raw fed are more diverse and might have better health, if you will. But our lab here at Ohio State has published papers looking, and these efforts were led by Adam Rudinsky, of actually showing that raw fed diets potentially pose a big risk from the human perspective for zoonotic transmission, things like Salmonella, E. coli. And so the FMT consortium and also our fecal bank here at Ohio State don't allow any fecal donors to be raw fed because of that zoonotic potential. And so in that parvo study, we are actually looking at that head on to see if we see any short-term clinical outcome differences between donor type. And my hope is, I don't eat my words, but my hope is that they'll perform similarly, and that hopefully will lead to us not using raw-fed donors, which will help mitigate the risk to our pets, but also the people that care for them.
Absolutely. I could see that being a tough one if there was a difference with raw fed and the microbiome to say, yeah, but is it worth it when we're talking about potentially drug resistant microbes here?
Yeah.
That's a tough one.
The other thing to mention with lyophilized, because, a lot of people have thought that enema is kind of a great route because you're putting those microbes exactly where they need to be within the colon. But Animal Biomes actually put out several publications because, again, their product, they don't need a prescription to get the oral capsules. Your owners can order it themselves and get their pets started on it. And in their large cohort studies, they have shown an improvement in chronic enteropathy in dogs and with these oral lyophilized capsules. So dogs are not getting enemas in that study. They're getting these oral lyophilized capsules and they're having clinical improvements. So I think, if for chronic enteropathy, if you're not interested in maintaining a fecal bank and all that within your practice, these commercial options are really valuable for our pets, and we really should be thinking about them as adjunctive therapeutics.
Very cool. Very cool. I mean, I am so happy we got to have this conversation because veterinary medicine in general in the last several years has been really exciting in terms of all of the different things that we're learning and the options that we have. For me personally, I find this particular topic to be one of the most exciting emerging areas because of all of the possibilities and all of the information that stands to be gained from research like this. So I can't wait to continue to hear what comes next and more data about, certainly enteropathy, but other body systems and how we can benefit different patients through something that, I say this, it seems so simple. I mean, I know with everything that you're going through, that you're researching on your end, that it's not simple at all. But, dogs are going to poop. We're going to have those samples. And to be able to make such a big difference with something that is maybe simple is not the right word, maybe readily available is a better word. Just seems so cool.
Yeah, absolutely. And I think it's really rewarding for me, and I know other veterinarians, to watch our patients live much longer, healthier lives. And I think that's going to be more and more part of that discussion is how do we maintain microbiome health in order to promote healthspan for our pets? And so we talk a lot about fecal transplant and the microbial community and disease, but I think there's a large interest in also trying to think preventatively about how we address this community and how do we keep the microbes healthy to try and promote that health span for our pets. And I think there's emerging evidence that on the human side that this area of microbiome aging and how we support a healthy microbiome in the aging process is important. And that's going to be really critical for us moving forward in vet med when we think about more preventative strategies of manipulating the microbiome to promote that health span.
Absolutely. Well, thank you so much for joining me to talk about this more. I hope that we can continue this conversation because every time we do talk about this stuff, I get really excited and I'm like, oh, this is so cool. Are there any final thoughts you want to share? Something you want listeners to absolutely take home with them?
Yeah, I think the big thing for me is really starting to think about the microbiome as an organ system. And I know that all of us, we have certain moments as clinicians where we pause and think about, like say you have the elderly cat that you need to put down, put under anesthesia for a dental. That pet, you're thinking about how are you going to support their kidneys during that procedure, right? I think more and more as clinicians, we need to start thinking about what those pause points are for us in the microbiome and making sure that we're thinking about it as an organ system to help promote that health span for our pets.
That is such a good take home of, making sure that we're keeping the microbiome in mind the same way we keep all the other organ systems in mind in our patients. So thank you so much for joining me. Again, another fascinating conversation. I can't wait to learn more.
Thanks so much for having me.
Well, I'm sure you could hear my excitement throughout the episode, but I hope everybody else enjoyed that episode and learned a lot just like I did. I want to say a big thank you to Hills for making this episode possible. Dr. Winston, it is always great to get the chance to talk with you. Thank you so much for joining me. And of course, thank you to everyone for tuning in. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. If you'd like to hear more episodes, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM, or you can follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.